throughout my career, I have found that I generally can get things done, make things happen, try to improve the status quo by working with people. And I still hold out some hope that we will be able to do this with the General Assembly. We talked about what the Senate did with the bill, and I said, look, it was an improvement, and I was trying to, create the environment so that we could have a discussion. And we had discussion, but nothing really came of it after that. And so that's been my experience throughout my career, but so far we've not been able to do that with this issue. But I'm still, have some hope, certainly, that we'll be able to do this. But I will have to veto the bill. There's no governor that I can think of in Ohio who would have not vetoed this bill. And I will have to veto it, not so much for me, certainly, because we're coming out of this pandemic. But I'm very concerned about the future. I'm very concerned about a future governor and health departments around the state not having the tools they need to keep the people of the state safe. And the one thing we've learned about this during this pandemic is something that we thought was unthinkable has now occurred. 2 years ago, no one, except some real experts, ever thought about a virus that would kill this many people. We have people in the world who are terrorists. We have terrorist states who are thinking of different things that they could do to the United States. So we just don't know what the future is going to bring. And we have to be able to protect the people of the state. And it's not just the governor protecting the people of the state, but it's local health departments, because this strikes directly at the heart of the ability of public health in the state, local officials, to keep the people of the state safe. Let me give some examples. And we'll start off, first of all, the bill is unconstitutional. That's where we have to start. If the bill became law, it would grant the General Assembly the ability to overturn and modify lawful actions of the executive branch, not by passing a bill, which is the way it should be done. That's what the Ohio Constitution requires, is the passing of a bill. But by passing something called a concurrent resolution, that's not a bill. That's not a law. Further, second point about the constitutionality, the bill clearly violates the separation of powers. We'll have more about that in my veto message to the public and to the General Assembly. Let me talk about a couple specific examples. And let me go to what the bill would do if it became law. One of the parts of the bill says that in order for someone to be quarantined by the local health department, that person must come into direct contact with someone who has been medically diagnosed with a communicable or contagious disease. So for the local health department to be able to quarantine, and keep in mind, we've not done this during this pandemic, but someone who must be able to show that someone has come into, that person who is going to be quarantined has come into direct contact with someone who has been medically diagnosed with a communicable or contagious disease. So what does that mean? Well, early on in this pandemic, 2 Miami University students were coming back from Wuhan. And this was when the outbreak was going on over there. They flew in. They came back to campus. Now, they were very cooperative. They did everything that the Butler County Health Department asked them to do and the Miami University asked them to do. They quarantined. They waited the time. Tests were done. Took a while for tests to come back, but tests came back, and it was found that they did not have it, thank God. But let's suppose that they did have it, and let's suppose they were not cooperative when they came back. And let's suppose they just said, hey, we're going to go about our business. They could have contaminated hundreds and hundreds of people on Miami University's campus with devastating results in Butler County and throughout the state of Ohio, because you never would have been able to prove that that they had come in contact with somebody who had been medically diagnosed. Absolutely impossible. Well, let me take another one. And again, not far-fetched at all. Ebola, there's outbreaks of Ebola now in Africa. Different locations, different places. I had a conversation with Dr. Vanderhoff about this 2 or 3 days ago, about Ebola. And although we don't see danger now, but it's there. It is in these countries. So let's say somebody comes into the United States and we find out that they have come from the infected area of one of those countries. Do we really want that person to be mixing with society, possibly, sealing the medical fate of hundreds and hundreds of people? This bill would say that local health department could not stop that person from doing that. Couldn't stop someone coming in from a foreign country, coming from an infected area. Look, it makes no sense. I could go on, and we will have further examples. But the only thing I can think is that members of the General Assembly just, did not take this all the way through to the ramifications it would mean for the safety of their fellow citizens in the future. And the unknown, when the unknown becomes the known, when the hypothetical becomes real, the local health departments and the governor have to have the ability to move very quickly to save lives. So this is not about me. This is about the future and saving of lives. And it would be absolutely irresponsible for me to do anything but veto this bill.